Hello, my name is Mark Fisher. I'm professor of neurology at UC Irvine and a stroke neurologist.
Hi, I'm Steve Greenberg. I'm a professor of neurology at Harvard Medical School and also a stroke neurologist.
Let's first talk in a little bit of detail about what exactly is ARIA. Dr. Greenberg.
Yeah, thanks very much, Mark. It's really a credit to the American Heart Association, American Stroke Association for recognizing that this is going to be a growing challenge that will often come to us as vascular neurologists, even though many of us don't particularly work in the Alzheimer field, but the field will be coming to us with questions about immunotherapy as they relate to ARIA and other vascular issues. And we're really in a complex situation with ARIA that it is, as you say, quite common. And sometimes the imaging findings can be rather dramatic, but most often it's asymptomatic. It's most often a silent finding. And even in the people in which it's symptomatic, in which one of these things, for instance, the edema or the effusions trigger focal neurologic symptoms or headaches or seizures, the symptoms usually resolve pretty quickly with cessation of the treatment. And it's not at all clear that ARIA as a group is damaging to the brain. It seems that if you just take all comers with ARIA, they may do about as well as the people who don't have ARIA. There have even been some who think maybe it's a sign of the removal of amyloid and could even be marginally beneficial. But that said, it is not uniformly harmless, and there's a subgroup of people who have permanent neurologic disability or death. There have been dramatic reports of deaths either related to a kind of malignant edema that doesn't improve even over a course of hospitalization, or people with intracerebral hemorrhages, which are certainly damaging to the brain. This creates quite a conundrum for the treating physicians to know when to accept some risk of ARIA, but when to recognize the danger of ARIA and use it as a balancing factor against whatever benefits the amyloid immunotherapies provide. The mechanism of ARIA is probably complicated and may involve more than one step, but the common denominator seems to be the amyloid in the blood vessels. In a way, it's not surprising because both edema, effusions, and hemorrhage are all vascular phenomena. And it's a plausible model that has a fair amount of experimental support that it's direct interaction between these anti-amyloid antibodies that are given with the purposes of removing the amyloid in the senile neuritic plaques that drive Alzheimer's disease, that those antibodies can also engage with the amyloid that's deposited in the blood vessels in the form of cerebral amyloid angiopathy. And we know that cerebral amyloid angiopathy, CAA pathology, is quite common. It's particularly common in individuals who have Alzheimer's pathology as well. And that direct engagement of the antibodies may drive both the edema and the hemorrhage that is characteristic of these different forms of ARIA. And for now, that's probably the strongest working model for the basis of generating ARIA.